The most common signs of a heart attack are chest or upper abdominal sensations of pressure or burning, often mistaken for ingestion. And the pain may localize behind the sternum and radiate to either arm or shoulder. The pain can also extend to your hand, neck, jaw, teeth, upper back, and upper and middle abdomen. You have a shortness of breath, a feeling of nausea and sweating, and you'll have increased pulse rate and irregular pulse. This device here is what you would use to help a patient with a heart attack.
So you see someone lying on the ground, you think they may need CPR. You're going to go up to them and approach them. First, you're going to do your scene safety, make sure it's safe for both you and your victim. You want to quickly analyze this scene. Then, hopefully, if you have a kit, a safety kit, you'll have a CPR mask and gloves. First thing that you want to do is you want to put on your gloves. You also want to approach your victim or patient and tap them to see okay, because they might be sleeping, and in that case, they're going to be kind of mad if all of a sudden you're trying to give them CPR. So, excuse me, ma'am, are you okay? No response. Ma'am, are you okay? So now we know that there's something wrong. So now I'm going to call 911 and hopefully be able to get an AED just in case that they did fall from a heart attack or something of that kind. So if I'm giving CPR, that means that they do not have a pulse, and that means that I am going to need an AED. So now what I'm going to do is I'm going to do a head tilt lift, chin lift. And I'm going to access for their ABCs, airway, breathing, and circulation. I'm going to look at their chest and look to see if it rises. I'm going to feel if I can see it, the circulation in my ear, and I'm also going to be listening for it. I'm going to do this for 5 to 10 seconds. So right now I don't feel anything. So what I'm going to do now is I'm going to take out my CPR mask, and I'm going to give 2 rescue breaths. Sometimes that's just what people may need, and also you do this to make sure that their airway is not blocked. Because this is a dummy, their mouth doesn't move, so I'm kind of struggling putting the CPR mask, but you don't ever want to do this. Alright. So I'm going to make sure that their head is still back and their chin is lifted. And you want to give 2 rescue breaths. Usually you want to see their chest rise, but because this is a dummy, it does not have a bag to show the chest rising. I'm going to assume that they went in. Next, after that, if they went in, you can assume that the airway is not obstructed, and you don't have to do modified CPR. But we're going to assume that it did go up. So now I'm going to look, listen, and feel for 5 to 10 seconds. Now, before I wasn't checking for a pulse, but now that I know that their airway is not obstructed, I am going to be checking for a pulse. So you want to check for their carotid, put your 2 fingers in the groove of their neck. You want to come back down and listen for another 5 to 10 seconds, and I'm going to assume that they don't have a pulse, right? So now I know that they're going to be needing CPR. If they did have a pulse, then you'd be doing rescue breathing, and that means that there's no compulse. So now I'm going to go right into my compressions. You go to their nipple line, and you want to put the palm in the middle of their chest right below that line. You want to make sure that your shoulders are square over their chest, and you want to make sure that your arms are locked. You're going to give 30 compressions. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's 30 compressions to 2 breaths. So I'd continue this for 5 cycles, right? That's however many. That's a full amount of CPR. After I do my 5 cycles, you're going to assume that you have the AED. Sorry. And you're going to now turn on the AED.
This is a training device only. No shock will be delivered.
AEDs are pretty self-explanatory. They tell you basically what they want.
Remove clothing from person's chest.
So if there's clothing, I'd remove it.
Attach pads firmly to person's chest as shown.
The pads are very simple because all pads will have pictures of where they want the pads to go. So all you have to do is follow the pictures.
Plug-in connector.
Hopefully your
Check
pad will
connector and
be
pads.
more sticky than that.
Check connector and pads. Check connector and pads.
When you place the AD, you want to make sure that it's between you and your patient so you don't
Check
have to reach over
connector
them
and pads.
constantly.
Analyzing rhythm. Everyone stand clear.
You want to make sure that everyone is standing clear by saying no one touched the person, analyzing rhythm.
Shock advised. Charging. Everyone stand clear. Everyone stand
I'm
clear.
clear, you're
Push
clear,
the shock
stay
button.
clear. I'm going to shock the victim.
Shock delivered. Begin 5 cycles of CPR.
So now I'd go back to my cycles of CPR. 3, 6, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 4, 5, 6, 7, 8, 9, 10. And you do this until either the EMS arrives or your victim comes back to life.